Earlier this month, the governor's office requested 10% budget cut proposals from all departments. According to the governor, this is due to a combination of factors, including what turned out to be an incredibly expensive wildfire season and reduced revenues from coal, oil, and agriculture. And now residents are growing more and more concerned as to what these budget cuts could mean in the Department of Public Health and Human Services, specifically for our children.
He was born with multiple congenital anomalies, and later they diagnosed him, they added developmental delays onto his diagnosis. And then he went again at 12 months, and that's when it showed significant delays. They got him into speech therapy, occupational therapy, and physical therapy.
Among the proposed cuts includes eliminating the Family Education and Support Program and the Part C Infant and Toddler Program, both of which serve developmentally disabled and at-risk children. 3.5-year-old Aiden is just one child who could be impacted, along with nearly 2,000 other families across the state. An online petition by Quality Life Concepts has gained over 18,000 signatures.
Orange.
It can be tough, you know, you go to the playground and your child's so much further behind than other little kids playing around or whatever, but when you're involved with QLC, you know you're not the only one. You know your child's not the only child, and that even though he may not be caught up yet, he's making progress.
Thanks to the Part C program, families are assigned intervention specialists who assist families by providing resources and teaching parents to work with their disabled child outside of the doctor's office. Those specialists say the long-term effects could be devastating.
For example, in Montana, we know that 67% of the kids that we serve in Part C services do not go on to attend special education services. That's a pretty impressive number. The expression is, if you pay a nickel now, you save several dollars later, and it's true.
At a minimum, 15 people will lose their jobs just at the Quality Life Concepts location here in Great Falls. And by cutting the programs, the state will essentially be forfeiting millions of dollars in federal funding to save what amounts to just over $5.6 million a year.
Well, I've been doing this job for a long time, and I'm very nervous about this. I think that there's been a lot of factors that contributed to the need for these cuts. And I wish the legislature had done a better job in addressing those issues when they were in session. And I truly hope that they are willing to make the corrections necessary.
Now, if these cuts go through, Montana would be the only state in the country not to have a Part C program. A final recommendation is set to be made sometime next month.